Thank you. Thank you very much. Let me switch on here the timer. So I'll try to stay on time. So first of all, thank you for the invitation. It's an honor to be here to talk about some of, let's say, my experiences that I recently have done in this area of applying machine learning to electronic health records. So it looks a little bit boring if we consider the amount of data that we are currently gathering from day-by-day hospital activities, including images, textual notes, signals, so a huge amount of data. Well, the talk will be on this more, let's say, restrict number of data, that is the coded data. And I want to basically discuss with you that behind the coded data that seems simple, there are a lot of issues that may hamper the real use of machine learning there. But before to start, let me give you a little bit of disillusion, because yesterday we had a talk about Professor Edelman, who actually talked a lot about the Italian history of medicine, and he mentioned, several times that in Italy and in particular in Padua there were a lot of very important discoveries. Actually, I need to tell you that Pavia is not Padova. So somebody asked me yesterday, well, it's the same place. No, well, actually not, because you see here Pavia is nearby Milan, and Padova is close to Venice, so they are quite far apart. And even though, what we can say is also Pavia is an old university, okay? It's a university since 1361. It's a nice city. It has a lot of historical buildings and historical venues. I know that Federico Cabeza probably gave a talk here in one of the historical halls of our university, probably the nicest, I would say, that is named after a poet called Foscolo. And just to complete the story, we also have an anatomical theater. And actually, the thing, just making reference to the history of medicine, actually this anatomical theater was basically a revised version of the Padova one. So they were first, we need to admit it. But after that, Professor Scarpa moved from Padova to Pavia, and he had this idea of improving the design of the